All right, kid, listen up. So you get your bell rung, no big deal, you're fine. Now, I need you to go back out there and win us this game. No pain, no gain, am I right? Well, coach may not have been right after all. We now know that having your bell rung is in actuality a concussion, a serious injury with consequences to mood, memory, and cognition. Concussion has been dubbed the silent epidemic because right now there's no diagnostic test like CT or MRI that can tell us if one has occurred. So how do we actually know if someone has a concussion? Right now the only way is when a patient reports having symptoms like headache or dizziness after sustaining a head trauma. This can be a bit problematic since we know that athletes are not exactly known for their full disclosure of symptoms. So to get around this issue, and to take the onus off the patient, we look to neuropsychological testing. Despite some promising findings, we now know that there are substantial limitations, including the confounding factors such as musculoskeletal injury or even the stress of impending exams, which can negatively affect the test results. More sophisticated neuroimaging techniques have yielded important insights into pathophysiology, but these tests are time-consuming, expensive, and generally inaccessible to non-researchers. But there is one test that might be able to detect concussion. It's called the Visual Evoked Potential, or VEP. For this test, all the patient has to do is sit in front of a computer screen with a red and white checkerboard pattern on it that switches each second. And each second, we record the brain's response to that switch using surface electrodes. This 2-minute process then yields a waveform that we can then measure. So we sought to ask the question, can concussion be detected by the VEP? We gave the VEP to concussed patients between the ages of 9 to 25 and compared these with healthy controls. We found that while symptomatic, the VEPs of the concussed patients were both slower and less well-formed than those of the control group. The concussed patients then had the VEP at each follow-up appointment until they had recovered. While still symptomatic, their VEP remained abnormal, but at the point where they told us they were symptom-free, their VEP had improved. It was faster and had a better waveform and looked a lot more like the group without a concussion. So what does this tell us? Well, we think that the VEP can be an important clinical tool for the detection of concussion. And since it resolves in conjunction with clinical symptoms, it may also tell us when the brain has finally healed. The VEP, therefore, has the potential to provide objective evidence of the effects of a concussion. And this can be really important for students who need academic accommodations or athletes making return-to-play decisions. And it would help us tell old coach that the kid needs to sit out a few games. Thank you.